Hi, my name is Sajid Surve, and I'm a DO.
Hi, my name is Fredricka Barr, and I'm an MD.
It's no secret that we DOs love our slang. We love using terms and special things that can sometimes be confusing to other healthcare professionals. So our hope is that we can go through some of these DO terms and clear the air so that we all know what we're talking about. How's that sound to you?
Sounds great. Let's do it.
Let's get into it.
DO slang.
Somatic dysfunction. What do you think?
Something's wrong.
Something's wrong. Somatic dysfunction is very simply a problem in the body that doesn't rise to the level of a medical diagnosis, but is there. It's causing problems for the patient. And this is problems with somatic dysfunction are what we can use our hands to treat. And we're going to talk about OMT in a minute, but this is when we can use our hands to treat a problem.
Perfect. 4 tenets.
4 tenets. Ooh, what do you know about 4 tenets?
Okay, I know the body is a unit.
Body is a unit. Very good. That's one. The next one is, I'll spot you one.
Okay, good.
The next one is the body is capable of self-healing, self-regulation, and self-maintenance. Okay. What's the 3rd tenet? Do you know?
It is structure and function are interrelated.
That's right. Very good. And the 4th tenet is that rational treatment relies on the first 3 tenets. And so when you take these elements together, what it means is that we need to look at patients as a whole person and a whole situation, not just their physical complaints or whatever their chief complaint is. We need to think about their entire situation, think about how their body is functioning, the structure of their body, and come up with a treatment plan that's going to take all of that into account. And so this is really the philosophical underpinning of our profession.
Perfect. Tart changes.
Ooh.
Yes.
You hungry?
Yes, I am. What are we going to eat? What are we going to eat?
So when we talked about somatic dysfunction, we define that by having one of 4 terms. So TART is an acronym. The first T is for tenderness. A is for asymmetry. So if the things just look asymmetrical. R is for restricted range of motion. And T is for tissue texture change. So when you touch that tissue, it just doesn't feel the same as the tissue surrounding it. If any of those things are present, then that area has somatic dysfunction.
Okay, that makes sense.
Mm-hmm.
ONT.
There it is.
I got this.
All
osteopathic manipulative treatment.
Right on the money. Woo!
That's right.
Awesome. OMT is osteopathic manipulative treatment. OMT is a procedure. This is when we put our hands on the patient to make some change in that body to treat that somatic dysfunction. The procedure is OMT.
Muscle energy. I always feel like I have to say it like that.
Gotta strike
Muscle
a pose.
energy.
Muscle energy. So when we talk about OMT, OMT has many different treatment models. So different ways that we approach the body depending on what we're trying to address. Muscle energy is one of the models that is used to address muscles. So that kind of makes sense. And with that model, we're using the contraction. The patient is actually going to contract their muscles, and that contraction is what we're going to use to help realign a joint or to reduce tension or to stretch something out. So we're using the patient's muscle energy to help treat their body.
Perfect.
Mm-hmm.
Muscle energy. All right, moving on.
5 models.
5 models.
Okay. So this is getting into more of that philosophical piece. 5 models as a big picture. It's kind of like a checklist that we use to make sure that we're thinking about all the different elements that might be contributing to a patient's disease, or to make sure that we're coming up with a treatment plan that's as holistic as we can make it. And so these are just different areas where things can go wrong with a patient that we want to make sure that we're addressing when we ask questions and also when we come up with a plan. The first one is the biomechanical model. And so as we talked about with OMT and structure and function being related, we want to look at the body and see, are there any problems with the way the body's put together that might be getting in the way of this person's illness? What's the next one? What do you got? Behavioral. So is there anything that the patient is doing that might be interfering with their ability to get well? So do they have certain behaviors? Maybe they have some habits that need breaking, or maybe they need some lifestyle changes that need to be addressed. So we want to make sure that we're taking that into account. Okay, I'll give you the next one, respiratory circulatory. So the respiratory circulatory model is referring exactly as it says, your breathing, your heart rate, your lymphatic system. We want to make sure that all of those are working optimally to deliver nutrients to the body where it needs to go, to clear fluids out of the body where that needs to go, and make sure that the patient is functioning optimally. Do you remember one of the other ones?
Neurological.
There we go. Neurological, so that's as it implies. Your brain and spinal cord and peripheral nervous system and autonomic nervous system. So the way that your nerves interact with your body to make sure that all of your muscles are functioning and also that all of your organs are functioning properly. And our last one is metabolic energetic. So metabolic energetic model is referring to really your endocrine system. So do you have good metabolic health? Are your hormones in proper balance? Is everything working together the way that it needs to without any dysregulation that might be leading to disease? And so if we think about all these things, those add up to the 5 models, which is a way to approach patient care.
And I love that. That way we're not missing anything.
Mhm.
Yes. Counterstrain.
Do you like counterstrain? You like it?
I do.
I do.
I really like
Everyone
it.
loves counterstrain.
Yes.
This is one of our treatment models for OMT. So like muscle energy was using muscles, the patient's contraction of muscles to affect change. In counterstrain, this is super passive. We're just putting the patient in a nice, comfortable position where they can fall asleep, and we're just letting the body take care of itself. So this one is very gentle. Pretty much everybody can tolerate this one. And so it's one of our most gentle treatment models within OMT.
Magic OMT.
It's
That's
magic.
the magic.
Absolutely.
Allostatic load.
This is an interesting term. What do you know about allostatic load? What do you think about it?
So allostatic load sounds like, a way of just approaching a patient to see what is causing them stress. Yes.
Yes.
Anything, physically, emotionally, anything.
Exactly. I think you put it really well. It's all the external factors that weigh into a patient's health and well-being. So financial stressors, emotional stressors, relationship stressors, job stressors, any of these external stressors that add up to create problems for a patient. So it's their entire situation. And we want to reduce their allostatic load when that's interfering with their functioning.
Looking at the patient as a whole.
Mm-hmm. ONMM is a specialty. It's a residency that you can do. It's a board certification that you can obtain. It stands for Osteopathic Neuromusculoskeletal Medicine. And this is in order to be board certified in ONMM, that makes you an expert at OMT and osteopathic principles, and also allows you to be able to teach OMT to others.
I feel like you could say that so much better than me. You just said it so...
I don't know. HVLA.
HVAC, right?
HVAC.
HVAC, right?
Maybe.
No? Okay.
HVAC. So that one stands for high velocity.
Low amplitude.
There you go. So this is when we are popping joints. So when you crack your knuckles, when you twist and you crack your back, right, you're performing high velocity, low amplitude. You're providing an impulse over a very short distance to correct a problem within the joints. There you go. This has been DO Slang. If you liked it, if you have terms that you want to know more about, send us a comment, let us know, and maybe we'll do a part 2.
Part 2.
Bring it on. Thanks so much, guys.
Bye.